Good afternoon. Thank you for watching our live briefing for Tuesday, June 9th. Today I have a brief update on the COVID testing here at Westminster Canterbury Richmond, and I'll have a few comments, and then Lori Yount from the clinic will provide you with a clinic update and a little education relative to wearing your masks correctly. After Lori, Scott Jonte from dining will tell you about plans to slowly restart some of our dining operations in the coming weeks. And Chaplain David Curtis will have our pastoral care segment today. I just got to say, it was great to see so many of you out today at the Tunes on Tuesday program out on the courtyard lawn. It's fabulous that we can have such talent come right to us and spend the day with us. I know it was hot out there, but thank you all for making it such a great time. Hopefully we can continue with that. I know a number of you are probably wondering how it went yesterday with residents leaving campus and returning in the afternoon or throughout the day. We had 199 residents go off campus and return yesterday. And Glenn Kemp just told me right before I came on that we had 119 people leave so far today. It's great. I'm hopeful everybody's taking care of themselves while they're out there. Yesterday, I think of all the 199 that left, there were 4, I believe, who needed to be followed up with by nursing for one reason or another. Hopefully everyone continues to be really careful. Next, I want to give you just a quick update on the testing that we're doing in Parsons Health Center and in the assisted living areas on campus. In assisted living, today I'm really pleased to share with you that all the residents of Monticello and Gables assisted living areas have tested negative, which is fabulous, and means really what it means is that everybody residing in our assisted living now has had a negative test, and that's fabulous news. Today, we retested all the residents, or will be, I'm not sure if it's done yet, retesting all of the residents in Avalon assisted living, so that as soon as they get that result back and we get a second negative for everyone, the residents in Avalon can come out of quarantine. And my understanding is that Monticello and Gables will be retested on Saturday this weekend, and so that early next week they will hopefully all be coming out of quarantine as well. Really good news. In terms of staff testing in Parsons Health Center, all of the Parsons first floor staff, which is so that you know, where all 3 of our COVID cases have been cared for, all of those staff have been tested now. 40 of the staff's results have come back all negative, and we are currently waiting on results on 12 remaining staff members. We should be getting those results back today, hopefully, or tomorrow at the latest. Testing for second and third floor staff will start tomorrow morning at 6 a.m. and we'll test all staff. We start that early so that we can catch both the night shift and the day shift as they come, as one group's getting ready to leave and the other group's coming in for the day. And we have 2 different rotations, as well as dining and housekeeping and others. So it does take us a couple days to get to all those staff, but we'll start that tomorrow. Mostly all of the assisted living staff have now been tested, and all of the results we've gotten back have been negative. We're still awaiting a few results, and those should come in the next day or so. So almost everybody that works in healthcare and in assisted living has been tested or will be tested in the coming days. And so far, thankfully, everything has been negative, and that's really good news, obviously. So we're thankful for that. Tomorrow, I'll be sharing some details on some of the additional programs and services that will be restarting next week, including massage, the CVS pharmacy, and then some changes that are coming next week to our grocery drop-off program. So more information on that tomorrow. On Thursday of this week, I'll be sharing some information about step 4 of our Westminster Canterbury Richmond Next Steps plan. If all continues to go well, step 4 is scheduled to be initiated on Monday, June 22nd. Scott Jonte is going to tell you about a major part of step 4 in a few minutes as it relates to dining. So please tune in on Thursday for more details. And like we've done in the past, after we get it to you in a live briefing, you'll get a memo update that explains what's all happening in step 4, hopefully starting June 22nd. Lastly, for me, I want to share some information about the coronavirus, just as ongoing education. We'll continue to do this. As I've said before, and I'll probably say it many times going forward, now that Virginia and Westminster Canterbury Richmond has begun to reopen, you need to understand that it's very possible that you or other residents around campus may be exposed to the coronavirus, and we may well see more infections. We've seen one a week or more all the way along, so we expect for them to continue. It's really important that you all understand the guidelines and understand what the symptoms of COVID-19 might be, so that if you're feeling unwell in any way, you slow down and say, this isn't right, I need to call the clinic. So per the CDC, Centers for Disease Control and Prevention, the symptoms of COVID-19 appear between days 2 and day 14 after being exposed to the virus. It's a long spread, almost 2 weeks from when you might have been exposed to when you might have symptoms. Now, those symptoms might include a long list that really includes pretty much anything that we might consider to be unwell, right? Fever or chills, cough, shortness of breath, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. Just by way of example, a quick story. A friend of ours, I shared this with the staff today, the executive staff and management team today, a friend of ours who's the CEO at Bridgewater Senior Living up in Bridgewater, Virginia, he recently, about 10 days ago, he was diagnosed with COVID. And so he got tested. Now the executive team at Bridgewater is all in quarantine. His only symptom was a headache and sinus congestion. He thought he had a head cold or maybe allergies. But as he came on campus, he answered the questions to the assessment and the screening honestly, and his nursing team tested him. He's at home now, and he's working from home, he's recovering, and he's looking forward to getting back to work. But he honestly thought he had allergy. He was just having his allergies were flaring up. He told his staff he wasn't feeling quite right. They tested him, and he tested positive. And he'd been following all the guidance and just really going to and from work, from what I hear. Now, like the rest of us, he has family and all that, so it's possible he got it from family. That's a pretty normal way it happens. But the point of that is just don't ignore the symptoms. If you don't feel right, call the clinic. We can get you tested. Stay away from your neighbors and your friends. Call the clinic. Let them do the test. Because it can be really subtle. So please just call the clinic. If you're having any symptoms at all, stay home. And that's really for everybody's safety, not just yours. As a resident group and as a staff group, we're incredibly vulnerable to this virus. So do everyone a favor, stay home and call the clinic. When you come back on campus, you go through the screening at the at the gate. If you don't feel right, let the staff know, and we'll get you into the clinic. Answer the questions honestly. It could be a matter of life and death, or at least wellness versus sickness. So we thank you for that. Take it seriously. If you're staff watching this, same thing. And I've said it before with staff, and we'll continue to say it. If you don't feel right, stay home. Call us. We'll get you tested. And it's the same for residents and staff. That's all for me. Next up is Lori Yon from the clinic. Have a good afternoon. I'll see you tomorrow.
Good afternoon. I'm sure it's both with excitement and perhaps a little trepidation that you're able to venture out into the community beyond our gates. So with that in mind, I'm here to talk about masks and being responsible for not only your safety, but the safety of other residents here. So mask wearing by itself is not effective, and it has to be combined with having clean hands, keeping hands away from your face, and social distancing. General guidelines for the masks are to put your mask on before you leave your home or your apartment and remove it when you get back. And as difficult as it is, try not to play with your mask after you have it on. If you're getting in your car and going somewhere, then take your mask off and when you get in your car, and then put your mask on before you get out of your car when you've reached your destination. And also take a good look around at where you're going to be walking. Make sure there aren't obstacles that maybe you're not going to see. We don't want you to trip over them, because that's can happen very easily when your vision might be a little bit obscured. There's been information given on how to wear a mask and not wear a mask, so I'm not going to go over all those. But I do have some observations, and it would be to remind you that when you put your mask on, you want to put it on so it's over your nose and leave it there. If we've had a lot of residents who feel like they need to pull the mask down to talk to somebody. We can hear you fine, so once your mask is on and you're not in your apartment, just leave your mask on your face. There's more information about masks, including some laundering instructions coming up in the tails later this week. And then just a few reminders about accessing the clinic. Like John said, yes, please do call if you have new onset of symptoms, especially something respiratory or fever. We are not having walk-ins in the clinic. We've said this before. But if you have a concern the clinic needs to be aware of, or you're in need of services, please call the clinic. Don't just come down. This serves to help us serve you better. We can anticipate your needs because we'll have talked to you on the phone. We kind of do a little bit of a triage. It minimizes or eliminates your wait time, and it maintains the social distancing guidelines that are so important right now. If you have an appointment, please wait for the clinic staff to call you to come down. Again, this will decrease your wait time and maintain those social distancing guidelines. Sometimes we have up to 3 practitioners at one time in the clinic. The staff needs to clean and disinfect the rooms in between, and if you're sitting in there waiting, that's just all the longer you're going to be waiting, and all the more residents that'll be waiting as well with 3 practitioners. By controlling the flow of residents, we can do what we need to do to keep you, our residents, safe. So thank you so much for helping us help you all stay safe and healthy. And next up is Scott Jonte with some dining updates.
Well, good afternoon, residents. It's a pleasure to be here today to talk about dining. First of all, thank you for your patience. And as John indicated, I'm here to discuss and describe some of the first stages that we're going through. We look forward to welcoming you back in person into dining, but just to let you know, it's going to look a little bit different than what you may be accustomed to. We've implemented many new systems in place, and today my goal is to walk you through, to give you an advanced preview so you know what to expect. And all of this information that I'm about to describe to you will be documented and sent out in the tails. On Monday, June 22nd, we plan to open the Promenade dining room. First, it will be only for breakfast and lunch. We ask that all residents make reservations for any meal period, breakfast or lunch, by calling extension 6030. At this time, we will not be accepting walk-ins. Please do not call the Promenade front desk to make a reservation, as that reservation line is still managing the room service delivery orders. When calling 6030 to make your reservation, you may have to leave a message due to anticipated high call volume. But don't worry, we will call you back within 24 hours to confirm your reservation. So please be patient. Reservation times will begin at breakfast at about 7 o'clock. Seating will go every half an hour. So first seating is at 7, 7:30, 8, and then 8:30. Lunch seating will follow the same format beginning at 11 with the last seating at 12:30. We ask residents not to arrive more than 10 minutes before the reservation time. This will enable us to keep our number counts low and to enable you to maintain social distancing from your neighbors. However, we also ask residents not to be more than 10 minutes late. We anticipate high volume, and what we're asking you to do is to be on time so that if in the event you're late, we can still have your table available. If you run late, we may have to give it away to someone else, or you may have to wait till the next seating. And also, please note that table arrangements in the dining room will be somewhat different than before. And again, this is due to the social distancing guidelines. So what can you expect when you enter the dining room? First of all, residents will temporarily be able to scan their badges for their meals as we used to do. No receipt will be issued unless requested. When entering the dining room, you must be wearing a mask. This is to protect you and your friends here at WCR. Upon entering the dining room, we're going to ask you to sanitize your hands as you're led to the table. At the table, the staff will take your orders, your beverage orders, as you head to the buffet. At the table, there will be a special plate provided for each resident to place their mask. While dining, you may be able to leave it there, but when you return to the buffet or exit the dining room, you must have your mask on. For service, attendants will be there to serve all the meals, as we will no longer be offering a self-service buffet. This is reminiscent of what we did before COVID. There will be an attendant at each station to provide service for you. Condiments on the table will be provided in single serving size packets. For example, salt, pepper, sugar, sweet and low. Upon request, there will be no salt and pepper shakers at the table or caddies. This is all for safety and security. Additionally to that, we put some additional layers of sanitation into the dining room, and so what you will see when you go to the dining room, you'll see stations throughout the venue that have sanitation stations set up for the staff to be able to clean and clear tables. Residents will see these dedicated areas throughout. All tables will be cleaned, cleared, and sanitized between each period, and at the end of each service period, we're applying a special layer of sanitation as well. Additionally, during this reopening process, we will continue to offer the room service delivery for those who want it for all 3 meal periods. However, please note that when the Promenade opens for breakfast and lunch on the 22nd, pricing for those meal periods will revert back to the original Promenade pricing. That is $6 for breakfast and $7 for lunch, regardless if you eat in the Promenade or have room service. Again, it will be reverting back to $6 for breakfast, $7 for lunch, regardless of whether you dine in the Promenade or have room service delivery. In closing, this is the first step in a multi-step process in re-engaging dining. We hope to have a following announcement on Monday, June 29th. Every step that we take today hinges upon how well we do with the previous step. At this time, all of this information will be represented in the tails. Please feel free to read through it and ask questions. We're here to help and serve you. Up next is David Curtis from Pastoral Care.
Good afternoon. I'm David Curtis, one of the chaplains here at Westminster Canterbury. And a programming note from Pastoral Care. Please mark your calendars. We will have a service of Thanksgiving for the Montague Chapel on Thursday, July the 2nd at 10:30 a.m. The service will be recorded, and everyone is invited to watch on TV 970. For those that are not able to watch it on Thursday, July 2nd, The service will be reshown the following weekend. Following the service of Thanksgiving, residents are invited to come to the chapel through July the 15th to offer prayers of thanksgiving, to remember our services of praise and our services of mourning, to remember communion shared at the holy table there, and to remember voices raised in song. On or around July the 15th, we will begin the process of relocating the stained glass windows from the current chapel to the new chapel that will be located in the spiritual center. Residents may still come to the chapel in the tower on their own to have private time there until early to mid-August, at which point we will transition completely to the spiritual center. The chapel will obviously look very different with all the stained glass windows and some of the pews removed. Pastoral Care is working with several departments to help make this move as less disruptive as possible. So please bear with us as we manage many moving parts. So we are asking for a little grace during this time of transition. And now hear these words of Scripture from the prophet Micah. What shall I come before the Lord? With what shall I come before the Lord and bow myself before God on high? Shall I come before God with burnt offerings, with calves a year old? Will the Lord be pleased with thousands of rams, with 10,000s of rivers of oil? Shall I give my firstborn for my transgression, the fruit of my body for the sin of my soul? God has told you, O mortal, what is good. And what does the Lord require of you but to do justice, to love kindness, and to walk humbly with your God? The word of the Lord. Thanks be to God. We usually end with a prayer at this time, and today I want to offer a prayer in the words of a young woman in first century Palestine when she was told that something miraculous and changing would occur. Hear the song of Mary. And Mary said, "My soul magnifies the Lord, and my spirit rejoices in God my Savior, for he has looked with favor on the lowliness of his servant. Surely from now on all generations will call me blessed. For the Mighty One has done great things for me, and holy is God's name. His mercy is for those who fear him from generation to generation. He has shown strength with his arm. He has scattered the proud in the thoughts of their hearts. He has brought down the powerful from their thrones, and he has lifted up the lowly. He has filled the hungry with good things and sent the rich away empty. He has helped his servant Israel in remembrance of his mercy, according to the promise he made to our ancestors, to Abraham, and to his descendants forever." Thank you for joining us today, and please join us for our next update tomorrow, Wednesday at 3 p.m. Thank you.